This is the preoperative fluoroscopy view of the fracture base of the fifth metatarsal. You can see the displaced fragments, and before we are going to localize the fracture with the K-wire, and this is another image. You can see the displacement before reduction. So now I am going to take you to the surgical steps of this procedure. So today we are going to do the very important topic, fracture base of the fifth metatarsal, like a Jones fracture. And as you have seen in the image that the fracture is displaced and the proximal fragment is very smaller in size, but still we will try to put the headless screws, percutenous, for the better reduction and stability of the fracture. We'll put the plaster after that. So first we have to mark the metatarsal, and I have palpated here. This is little bit posterior. Always metatarsal, fifth metatarsal base is little bit posterior at the junction of the dorsum and plantar surface of the foot, and we have marked the position under the fluoroscopy. This is the base, and 1 centimeter just above the base we are going to make the incision. So knife please. Just will make the stab incision. I have put the tourniquet, but I am not inflated. So we have marked the position of the K-wire in the C-arm. Can you show me please? Pause. So we have marked the position of the K-wire. Can you shoot again? No, so we have put the one K-wire. So after putting the joystick, I have tried to put the foot in the abduction and eversion, and you can see this fracture is reduced in the satisfactory manner. And now I am going to pass these screws further, and after that we will put the guide wire. As you have seen in the image, to stabilize the fracture and for the reduction as a joystick, most important thing, how we are going to reduce the fracture. Always, because of the peroneus brevis, the fracture is little bit in the position of displacement. So do the abduction and eversion of the foot. The fracture it's spontaneously reduced, and just try to manipulate with the joystick. And then now I am going to put the guide wire. So show me please. Show me. So this is the view after putting the guide wire, and you can see this fracture is reduced here. Now I will pass this guide wire. Always check in the AP and lateral positions, and after that I will go for the drilling over the guide wire and put the headless screws of 30 mm size. Put this the guide wire, and we can see in the C-arm that fracture is well reduced, and second guide wire is along the joystick wire. So only thing you have to remember for the reduction technique for this fracture. And now we are going to drill in the proximal fragment, and then we'll put the headless screws. After the drilling, we are going to hit the headless screws. This you can see this is the titanium one. So always I am facing the difficulty, like this is very thin guide wire. So in the previous so many cases, there was guide wire already broke. So expecting this time it will not happen. Show me please. Reduce the fracture, and I am going to put this. Always try to remove the guide wire if you are putting the joystick, because there are very less space, so there are chances of breakage of the guide wire. These are the small tips, so you have to take care to avoid any unnecessary complication. So just slowly you are going to screw the headless screw inside. CM please. So this is the final picture after the reduction. You can see the contour of the metatarsal and base is well aligned, and this is the AP, and this is in the lateral view. So I am very much satisfied with the fracture reductions. So now we will do the wash and do the closure of the skin. So you can see this very small incision, and through that we have already put the screws which you have seen in the C-arm. So now we are going to close this with a simple ethylon 30, and then we'll put the back slab. So now I'm going to put the one stitch here. So this is very efficient surgeries, So in this there is with one stitch you can do the reduction. Cut this. So this is done now, and now we will do the dressing and put the back slab. So this is after dressing and putting the back slab, and after 4 weeks we will allow the patient for the walk.